pro-inflammatory cytokines. I'm writing a new book on that as we speak, talking about how Candida and those pro-inflammatory cytokines can increase inflammation in chronic fatigue, fibromyalgia, and autoimmune, also damage energy production, increase cognitive brain fog, depression, and we could go on, irritable bowel syndrome. Beyond that, Candida overgrowth also increases a toxin named acid aldehyde, which is a toxin that can affect brain function and can actually contribute to brain fog. And acid aldehyde is a tremendously toxic byproduct of Candida metabolism. Now, acid aldehyde won't kill you, but acid aldehyde definitely can reduce brain function, not to mention numerous other toxic effects on the mitochondria and energy production. How do we diagnose parasites or Candida overgrowth? One is we do special types of stool studies, which I mentioned earlier. I have now found a stool study that I know and trust. It's hard to say you love a stool study, but I actually love this study because it has helped me help people that before we would not have been able to discover what their parasites were. The stool studies also show Candida overgrowth. Plus, we have a special urine test that can show us if you have Candida overgrowth with elevated levels of something called arabinose in the urine. We can check Candida antibodies by blood and Candida immune complexes. And of course, on physical exam, we look for rashes such as thrush, jock itch, rashes under the breast, groin, underarms, all of those, scalp, all of those may be an outward sign that you have Candida overgrowth. The fourth area where we've had tremendous success since the last update is with discovering and reducing food allergens. The most important food allergen that we've found is gluten. And we have found many people with autoimmune disease and fibro and chronic fatigue who are gluten sensitive and had not been diagnosed by their doctor. Many of their doctors have not even checked for it. Some of the doctors did check for it, but they only did the blood studies, which are not sufficient. The blood studies tell us if the gluten is damaging your bowel, but does not tell us if the gluten is damaging your mitochondrial process or increasing your pro-inflammatory cytokines. We do a saliva test. So not only do we do a saliva and the blood, both of those together give us a far better picture of whether or not you are gluten sensitive. And then if there's any question, we can put you on a gluten avoidance diet for 2 or 3 months, see if you improve. That is so important because millions of you out there are sensitive to gluten and you don't know it, and if you don't find out about it, you are going to increase the damage slowly for the next decade. So it is important that if you've not been tested for gluten, you do so. But if you've been tested for blood and your doctor said, no, gluten's fine, contact us about the saliva gluten. We also look, of course, for other food allergens, milk, wheat, corn, and others, because any allergen can increase the pro-inflammatory cytokines, which increases inflammation, reduces energy production, increases pain and damage. The next area that we focus in on is the endocrine system. We have found many people who are either low thyroid and were not adequately evaluated, as you must have a free T3 level. Many doctors now are just doing TSH, thyroid stimulating hormone, and if that is within normal, they're saying your thyroid is normal. That is not adequate. Many of my patients have trouble converting what's called T4 to T3, and therefore their T4 levels don't look bad, and therefore their TSH levels don't look bad, but inside the cell, on a cellular level, they are low thyroid. So we always do free T3, free T4, TSH, reverse T3 levels, along with the thyroid antibodies. Reverse T3 looks like T3, but it's the exact opposite. Kind of like those bad movies where somebody has an evil twin that looks just like them. Now, reverse T3 is not evil. It just, however, goes on to the receptors within the cell and does not turn on your metabolism. Therefore, if your reverse T3 is high, you're getting a lot of your receptors blocked by that reverse T3, and your thyroid is not able to work on a cellular basis the way that it should. We also check iodine levels, because nowadays in the United States, many people are becoming low iodine with people doing low salt diets and not getting enough iodine in their diet. And certainly iodine deficiency can contribute to low thyroid. We talked a little bit about thyroiditis, inflammation of the thyroid, which is one of the autoimmune diseases that I see most commonly, and that we work on a lot to reduce those thyroid antibodies so that we can keep your thyroid functioning as well as possible and reduce the destruction of your thyroid for years to come. Treatment is based on discovering the low thyroid. There are numerous thyroid supplements, medications, iodine supplements that can be prescribed once we recognize that your thyroid is low. The problem is that thyroids are not being evaluated closely enough. Continuing with the endocrine, we do a lot of work with adrenal rehabilitation. Many of our patients have worn down adrenal function called adrenal fatigue. They have low cortisone, low DHEA, which is a hormone produced in the adrenals that is a precursor for testosterone and estrogen. They have low pregnenolone, which is another precursor hormone that's produced in the adrenals. And they have low aldosterone, which is produced in the adrenals. Low aldosterone allows you to become low, what we call low volume, which means that you can develop low blood pressure with sitting or standing, called orthostatic hypotension. And when there is a neurological component, it is called neurally mediated hypotension. But many of our patients are low in aldosterone, and if you have orthostatic hypotension, where when you sit up or stand up you become dizzy or faint or cloudy thinking, almost certainly you have low aldosterone, and more than likely you have low adrenal function. If you have low cortisone levels, first of all, cortisone we must produce every day, generally roughly around 40 milligrams. Cortisone is thought of as being some sort of toxic medicine. It's not. We have to produce it every day from a normal functioning adrenals. More when we're sick or when we're under stress, less if we're totally relaxed. But when your adrenals are tired, you produce less cortisone, which allows increased inflammation, and the inflammation to run wild, and therefore increase your pain, increase your fibro, increase your autoimmune disease, and increase the damage to your energy production. Low DHEA contributes to low testosterone, which is also important in mitochondrial energy production. The lower the testosterone, and we see many men and women, testosterone is thought of as being a man's hormone, but women need it for energy just as much as men. You just don't need as much. And many doctors totally neglect looking at your DHEA and testosterone levels, so especially if you're a woman. Progesterone. Many women that we see are low in progesterone, and because they're either through menopause or they had surgical menopause, and what is forgotten is that progesterone is an important hormone for brain function, for energy production, for immunity. Right now in the United States, doctors think about progesterone as being only for reproduction. Therefore, once you get beyond reproductive age, or if you have surgical menopause, they think you don't need progesterone anymore. But study after study is starting to show the importance of progesterone in brain function, sleep, energy, immunity, and we can use progesterone to help support adrenals in women. We've been doing that for well over a decade. So I'm glad to see now that the studies are catching up with what we have been doing clinically for a decade or maybe longer. And estrogen, which is that nasty little word that right now many women have been talked into the fact that estrogen is some sort of toxic, dangerous substance. Now for many women, or at least for some, if you're at high risk of breast cancer, then estrogen supplementation may not be for you. But there are safer forms of low-dose estrogen supplementation that, if needed, can help stabilize sleep, improve brain fog, improve immunity. Yes, estrogen actually improves immunity and can help with your overall health. Obviously, that's something that we discuss on an individual basis and has to be something that you're comfortable with once I review the safer forms of estrogen that are available. There are, of course, also herbal things called phytoestrogens. Even though there's no estrogen in them, they are herbs that can help with some of these symptoms as well. So there's a tremendous amount of things that we look at that can contribute to chronic fatigue syndrome, fibromyalgia, and autoimmune disease. And if you've not had that workup done, you need to. Now, what about treatment? That's the great news. There is a tremendous amount of treatments available. Don't let anybody tell you that you can't get better, that there is no treatment, that you have to stay this way, because that is absolutely false. As I said, I've been doing this for 30 years now, hard to believe. And we have treated thousands of people, and we have seen them improve, and we have seen them go on to quality, what many people would consider normal lives. So there's a tremendous amount of hope. What do? Well, we work on that mitochondrial dysfunction. If we find mitochondrial dysfunction in your testing, I evaluate what nutrients seem to be deficient, and obviously we give those to you. If we find heavy metals, there's a way that we can treat that through chelation and other ways. If we find oxidative damage, there's a way to increase your antioxidants to improve mitochondrial function. There are numerous supplements available, too numerous to really mention on this video, that may improve mitochondrial function as well. Things like NAD, which I used to use by injection, but now is available by oral pill. PQQ, which is a nutrient that may improve mitochondrial function, and many, many more. So we can work with the antioxidants. We can reduce inflammation, and we can improve mitochondrial function. I've been doing that for 30 years, both with chronic fatigue, fibro, autoimmune disease, and prior to that, I worked with Olympic and world-class athletes to improve their energy performance using the same technology. There are antiviral therapies available, some of which you know of. Prescription antivirals such as Veltrex and Famvir and Velsite, which, while Veltrex and Famvir are not FDA approved for treatment of Epstein-Barr virus, many chronic fatigue clinics have used them for years because many patients seem to respond